Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about the topic cerebellum. It is a head ganglion of proprioceptive reception. It is the head of the ganglion of proprioceptive reception, as well as cerebellum is located in the posterior cranial fossa, especially on infratemporal fossa behind the pons and medulla. The cerebellum location is located in the posterior cranial fossa. The cranial fossa is divided into three, which is anterior, middle and posterior. This cerebellum is located in the posterior cranial fossa, especially infratemporal fossa behind the pons and the medulla. It lies below the tentorium cerebelli. The cerebellum is the largest part of the hindbrain. It is the largest part of the hindbrain. It lies below the tentorium cerebelli. The relation anteriorly, the fourth ventricle, pons and medulla, posterior inferiorly, squamous part of the occipital bone, and superiorly, tentorium cerebelli. The cerebellum consists of two cerebellar hemispheres united to each other through vermis. Now we will see the relation in the diagrammatic view. This is the cerebellum. Anterior to it there is fourth ventricle. This is the fourth ventricle, pons and medulla. Postero-inferiorly, backside, postero-inferiorly, it has squamous part of the occipital bone. Superiorly, there is tentorium cerebelli. Now, these cerebellum, these are the two cerebral hemispheres which are connected to each other. In cross section we have shown. But the cerebellum consists of two cerebral hemispheres united to each other by vermis. The vermis has two surfaces, one superior and another one is inferior surface. The superior surface is convex and the inferior surface shows a deep median notch called vallicula, which separates right and left cerebral hemisphere. The superior surface is convex. The inferior surface shows a deep median notch called vallicula, which separates right and left hemisphere. Each hemisphere divided into three lobes. There are two cerebral hemispheres in which each hemisphere is divided into two lobes, which is anterior lobe, middle lobe as well as flocculonodular lobe. The middle lobe is otherwise known as posterior lobe. Middle lobe is separated from the anterior lobe by prima fissure and by the posterolateral fissure. The middle lobe is the largest lobe of the three, and the flocculonodular lobe is the smallest of the cerebellum. This is the anterior lobe, this is the middle lobe, and this is the flocculonodular lobe. The middle lobe is the largest one, the flocculonodular lobe is the smallest one. These are separated. The anterior lobe is separated from the middle lobe by the fissure prima. The flocculonodular lobe is separated from the middle lobe by the posterolateral fissure. The parts are horizontal fissure, separate the superior from the inferior surface. The primary fissure separates anterior lobe from the middle lobe. The posterolateral fissure separates middle lobe from the flocculonodular lobe. When we make a cut or a cross section, we can see a tree-like appearance because the millions of neurons are there in the cerebellum. So it is this tree-like appearance is known as arbovitrae, which is the important one in the cerebellum. The horizontal fissure which separates the superior lobe and the inferior surface as well as inferior surface. The primary fissure separates anterior lobe as well as middle lobe, and the posterolateral separate the middle lobe and the flocculonodular lobe. These are parts of vermis. This is the vermis and this is the parts of the cerebellum. According to the vermis part, the cerebellums are here. When this comes to the central lobule, there is ala, here lingula, but there is no part in the cerebellum, as well as the culmen has a quadrilateral lobule. Like that, it comes for each part of the vermis to the cerebellum hemisphere. This is the image. I will show the parts of the vermis and the subdivision of the cerebral hemisphere. lingula, which has no part, central lobule, ala, culmen, quadrilateral lobule in the cerebral hemisphere. Vermis part is declave and the simple lobule. Folium, superior semilunar lobule. Tuber, inferior semilunar lobule. Pyramid, biventral lobule. Vulva, tonsil. These are the parts of the vermis and the subdivision of the cerebral hemisphere. For the mnemonics of the vermis, like Charlie Chaplin dancing for the party up north. This is the mnemonic for the vermis. The cerebellum is connect to the midbrain by the superior cerebellar peduncle. The cerebellum connects to the midbrain by the superior cerebellar peduncle. According to the brain structure, brainstem, first there is midbrain and then pons as well as medulla oblongata, so that the midbrain is the uppermost, so it is connected by the superior cerebellar peduncle, and the middle cerebellar peduncle connects the pons, which is the middle, and the medulla oblongata connected by the inferior cerebellar peduncle, which is in the below. Blood supply for the cerebellum are superior cerebellar artery, anterocerebellar artery and posterocerebellar artery. The clinical anatomy are: any lesion in the anterior lobe may cause ataxia. Ataxia means the patient cannot walk straightly and unable to walk in a straight line. Thank you. For more videos, please do like, share and subscribe my YouTube channel. If you have any doubt in it, please do comment it. If you have any doubt in any topic also, please do comment it. Thank you.